Okay, so next we'll be addressing the assessment portion of the CareTouch SOAP note. So basically, you're going to give your impression E&M, a new episode E&M, or reeval E&M. The daily impression's good. It's kind of set up for originally this medical CareTouch was for medical injection therapies. So I'll show you it, but it kind of reads a little awkward if it's not what you want. Um, then again, easily changing the wording if you do want a daily impression, but I'll show you the others, and I think they're a little bit better. As you can see, showing improvement, meeting expectations as indicated in today's subjective. Current status gives reaction to treatment, prognosis, and factors contributing to prognosis as well. So where it says medical treatment, they used to say medical injection therapy. It's one of those hyperlinks. So again, if you're co-treating with someone and they're coming back to see you for a reeval, you can kind of easily make that change, like if they're seeing someone for physical therapy, etc. If that's not the one I would use. Under the impression or the new episode impression, you have your options for assessment and diagnosis that'll automatically populate diagnosis for the day. So if we do assessment and you think they have a good prognosis, fair prognosis, or a poor prognosis. So we'll say it's going to be a fair prognosis. Does he have complicating factors? Say, I think, we put in that he had arthritis earlier, or whichever it is, there's good list, maybe it's patient compliance, or it's based on psychosocial factors, or patient's pregnant, etc. Or if there's no complicating factors. And then it just gives you your assessment. And if we had a diagnosis in the other page, it will put that in as well. So fair health, fair progress recovery, based on his history and examinations, reasonable to believe his recovery will take longer than, because we chose fair. And so I'm just going to minimize the screen and show you the other screen really quick. So this purple box on the upper right is your appointment box. So we're going to, quickly add a diagnosis. Oops, we got to save that SOAP note quickly though. So we'll change his diagnosis. You can search, you can find. We'll have to double check to make sure your standard diagnoses are also in there. Sometimes they're pretty easily to add. We're just gonna click some basic ones and give him that. And we'll post. You can also we're gonna make a fake appointment also with me just for that. And because you can't have a diagnosis without an appointment, basically, in this system. So if we just need to find a diagnosis, you can search by code or description, and we can give him, that's code, look for osteoarthritis, and let's go with the hip. And then if we open back up, double click within the yellow SOAP note, and it'll bring you back. Click on assessment, and if we just pretend we'll redo this one now that we actually have something. He had a fair prognosis, and we said because of osteoarthritis. And there we go. It will input his current diagnosis code as well. If this was a re-exam, go back, click up on assessment. It'll be a reeval assessment, and it'll allow you to monitor his ADLs. Like say you had been climbing stairs was a goal of his, and be able to climb stairs easily. So, and he said it's 50%, better. Then we'll click that. And if you change his diagnosis, you can click this one, or he's going to remain the same and continue to have the same diagnosis. It'll just write a little bit different summary. Make the screen a little bit easier to see. And there is Fred Weasley's reeval assessment instead of just a fair or standard assessment based on his short-term treatment goals, STG, and his long-term treatment goals are progressing, climbing stairs being addressed, His ability to climb stairs has improved by 50% since the onset of this complaint or condition. And then continue active medical treatment is necessary for this condition. New plan will be kept the same. Pretty easy. There's discharge summaries. If this was a phone call, email, or mail, you can also click one of those, and it was a phone call that you received, and then just insert. Kind of if it was a provider that you received, etc. If it was from the patient. And then you can just insert, and there's a little chart note place to click that if that's applicable to any of the settings. That is pretty much it for the assessments. Like I said, there's one for good, fair, poor within initials, and there's also places to put referrals, DMEs, or supplements, but there's also a place for that in the plan, so that's what you prefer. So the plan is going to be our place where to really make this customizable for you. So if you do have DMEs or durable medical equipment that you dispensed pretty easily, you can click, and it's what we're advised for, like cold packs. My preference for planned, if you do want consent to treat, is a pretty quickly report of findings, consent to treat, if you want to put that standardly in, and referrals. So if you're going to refer for testing, just go ahead and select your drop down. Say you want to do a CT scan for whatever reason. There's your quick referral noted in your chart if it's to a certain professional. Again, we can edit these if you have a specific nurse practitioner you want to refer to, or certain chiro, or a certain dentist, or a certain dermatologist, or cardiologist. We can just have kind of those written in as your standard, and then you would just click next, and it would put your referral into your person. And also same thing, if you refer for x-ray, you just have the region noted, and then you can just click back up in here at plan. And this is where I'd like to put any lab orders that you specifically from, I think LabCorp is what I was told, so when you use. We could put LabCorp orders, insert drop down box, kind of like with a referral provider. So this could say LabCorp drop down box of, if you want a list of thyroid tests or anything, we could have them sectioned out into, this one be thyroid, this one be standard diabetes test, standard whatever, and it would auto-populate them. Or you could just have a full list. I did look at LabCorp's full list of all tests, and looks like there's over 1,000. So your top 20, your top 50, top 100 would be pretty smart to put in here, as in smart links. Same thing if you do standard diagnostic procedures, or for chiro we do treatment provided today and list the treatments and for how long, etc. If your treatment was wart removal or sutures or etc., we could have those procedures listed as well as things you did in office. And then I also want to create a medications box so that when you click on it, it will prompt you for medication, and again, it can be a drop-down list of the standard ones that you usually prescribe, if there's metformin or standard supplements like iron, etc., and then prompt you for dosage, frequency, everything that you might need. Again, that prescription though is not going to translate to the CT RX kind of separate app, but that way in your chart note you're putting the same information and kind of have a standard to follow. And then that's all I have for full soap note.